Today I'll be presenting to you the Alice in Wonderland Syndrome by the Rare Diseases Club. And my name is Amaan Mohammed. So, what is Alice in Wonderland? So, let's start off with the preset notion that you all know what Alice in Wonderland is. Um, but if you don't, then we'll just go over the origins of it. So, the origins of Alice in the Wonderland, or where the name comes from. Well, the details in the story portray a young girl named Alice who falls through a rabbit hole into a fantasy world of anthropomorphic or human characteristic creatures. The protagonist, Alice, experiences situations similar to those that occur with this condition. The first acknowledgement of AIWS, or Alice in the Wonderland syndrome, was a clinical phenomenon that can be attributed to C. W. Lippmann in 1952 in a paper titled Certain Hallucinations Peculiar to Migraine. The founder of it, J. Todd, identified the syndrome as the first to name it in 1955 in the paper titled The Syndrome of Alice in the Wonderland in the High Roads Hospital in Menston in West Yorkshire. Also, you should be taking notes on the presentation because there will be a Kahoot at the end. Um, Moving on to the disease, more about it. So, as I previously mentioned, the protagonist Alice experiences situations similar to those that occur with this condition, meaning like an altered reality or an alteration of body image. 65% of cases with AIWS occur in children under 18 years of age, and in a prospective study on 9 children aged from 5 to 16, the mean age of AWS was onset onto 8.5 years. On the basis of 169 published case descriptions, the etiology of AWS was divided into 8 main groups, with neurological uh, disorders affecting mostly elderly adults and elderly patients, and encephalitis affecting mostly patients under the age of 18. And for those who don't know, encephalitis describes the inflammation of the brain parenchyma, typically by either an infectious agent or through an autoimmune process, which may be post-infectious, perineoplastic, or idiopathic. Um, Patients can be present with a combination of fever, alterations in behavior, personality, cognition, and consciousness. And some of the words I just stated are on the left-hand side and given their definition. And encephalitis is basically like an infection that can be both bacterial or viral. And in some cases, it can cause, uh, it can maybe the result of an immune system disorder. On the left-hand side is sort of a diagram of a patient experiencing encephalitis with an inflamed brain, and it can cause severe headaches. Now, the symptoms of AIWS. One of the main symptoms is altered body image. Well, the symptoms can be disorienting, they aren't harmful. On the diagram to the right is sort of like 3 different experiences that you can have with AIWS. One being distortions of visual and external space perception, the other being altered perception of yourself, the reality, or your body image, and the other being the altered perception of the passage of time. Some of the symptoms also include migraines, headaches, brain tumors, epilepsy, and altered body image, like I previously stated. And um, episodes of altered body image can happen several days at a time or for several days in a row, but symptoms may not be experienced for several weeks or several months. This is sort of an image displaying what it might look like to have or feel like to have AIWS. This sort of portrays Alice in like as very enlarged inside of a room where she feels uncomfortable. And sort of the diagnosis of AIWS is it's a rare neurological disorder. So it happens in the brain. And it characterizes by distortions of visual perception, which specifically happen in the occipital lobe of the brain, which you can see in the right diagram is the bottom right corner of the brain. That's where the occipital lobe is located. and it distorts the visual perception and the body image and the experience of time, like I previously stated. And people may see things that are smaller than they are, or feel their body size is altered in some areas, or they can experience any of the syndrome's numerous other symptoms, like I've previously stated on the other slide. On the left hand side is sort of what it looks like to have AIWS, where you see yourself with an elongated neck. And several lab tests have been looked towards this syndrome, which can help diagnose an infection. Um, so far, a test called the electroencephalogram, or the EEG, analyzes the electrical activity in your brain, and it's a key test for diagnosing the brain-related conditions like seizures and epilepsy. Now, treatment for AIWS. There has been no official treatment for this disease. The disease uh, will eventually wear out, um, and typically, uh, it's typically from brain tumors or psychoactive drugs or certain infections that cause AIWS, which has basically no proven or effective treatment. So why is it important to raise awareness about this disease? Although it's generally assumed that a syndrome is very rare, clinical studies among patients with migraine indicate that the prevalence rate of this group may be around 15%, and over 25 million Americans and their families are living with the rare disease, and 50% of those affected are children. So um, there have been several cases, you could say, of people in general having rare diseases. So it's important to look out for that. And 90% of all rare diseases have no FDA approved therapy. And so educating the public and encouraging their support is essential. So it's important to know about these diseases in general, basically promote awareness of them, because they can happen in the real world. And now it's Kahoot time. So I've linked a Kahoot for AIWS, which goes over some of the points I've stated about all the different factors, symptoms, and treatments. And thank you for listening.